Hello everyone, let's learn today side determination of patella. Now this is patella, and as you know it is the largest sesamoid bone, and it is found embedded and developed in the tendon of quadriceps femoris, right? Now if you see the shape of the patella, it is more or less triangular in shape like this, okay? And it has got an upper border or a base and two borders, medial and lateral border, and the meeting point of these two borders will be forming an apex, right? Plus it has got an anterior surface and a posterior surface. Now if you see the anterior surface closely, okay, let me show you. It has got multiple vertical ridges, you can see it. Particularly they are very much obvious if you see it from side, right? Now these are muscular impressions, and this will help you in identifying the anterior surface. So this is anterior surface, and just opposite to it a very smooth posterior surface you can make out, which is actually articular, and that is articulating with the corresponding articular surface of the femur, okay, and that will form part of the knee joint, right? So this is smooth posterior surface, the rough anterior surface. Now if you see the posterior surface, okay, if you see it from side, you will find a vertical ridge, and this vertical ridge will divide this articular surface into larger lateral part and smaller medial part, right? So this will determine the lateral and medial aspect of the patella, right? So this is laterally oriented, so here lies the lateral border and this will be the medial border, right? The meeting point of these two will be the apex. Now how to identify the apex? Just behind the apex you will find a non-articular posterior surface, right? The posterior surface entirely is not articular, very small portion of it is non-articular, right? And that lies below. So below to that non-articular posterior surface, which is actually providing attachment to the ligamentum patelli, over here lies the apex, right? So this will be the apex, which is facing downward, right? This will be the medial border, this will be the lateral border, right? This is anterior surface, this is posterior surface, and the upper one over here, if you see it from the side, you will find a flat base, right? So these are the bony features, and with that you can determine the side now. So for that what you will have to do is, you will have to just put the patella on a flat surface like this, okay? And what will happen, now you know this one, here will be the base, here will be the apex, okay, and this is the anterior surface. Now what will happen, the large posterior and lateral articular surface will be touching on the surface, right, and the smaller medial articular surface will remain off the ground or off the surface. So this will help in determining the side, right? The surface which is not touching the flat surface will be the medial portion of the patella, so this will be the medial, this will be the lateral aspect of the patella, and you can make out the apex and base as well, right? So this is right patella. Similarly if you see left patella, okay, this is left patella, so again you can make out the rough anterior surface, the smoother posterior surface, right, and with the vertical ridge, this is medial aspect, this is lateral aspect. So this will be the lateral border, this will be the medial border, this will be the apex, and you can make it confirmed by this non-articular surface, right? So this will be the apex, and remaining portion, this is flat base. So again you will have to put it on a flat surface, and from distance only you can make out the side of the given patella, just because the posterior and in the posterior surface the medial articular surface will remain off the flat surface, right? So this will be the base, this will be the apex, this is medial and lateral aspect of the patella. So this is left patella and this is right patella, okay? So this is how you will determine the side of the given patella. Hope you understood well. Thanks for watching.